But I think testosterone is still misunderstood. We think of it as a male hormone or as a libido hormone.
That's exactly right. A lot of people don't even realize that women have testosterone. So we, of course, don't have anywhere near as much testosterone floating around as men do. They have at least 10 or 20 times as much as we have. However, it's very important for women. It helps with libido. In my clinical experience with my patients, it's not the deal breaker factor. It can help when other things are in place. Libido is more complicated for us. It's not as linear as it is for the guys. So there's so many factors that matter to us in order to feel motivation in the area of sex and intimacy. But it's helpful with brain sharpness, muscle development, metabolism, mood. I really think that it's a mood stabilizer. Number one is the data is really very clear that estrogen does not cause breast cancer to happen. Most women get breast cancer. The average age is 68, exactly when my mom had hers. And that is 10, 15 or more years after menopause of not having estrogen. Okay, so we have that. We have, and this is not to say that if a woman has breast cancer, a woman with an active, newly diagnosed breast cancer, yes, I think she should come off of her estrogen while everything's being done, all the treatment. Okay, so we're not talking about feeding an existing cancer. We're talking about bigger picture, longer term picture, I should say. So even the WHI, so the WHI made that big, huge fuss starting in 2002 when there were two arms of the study. The arm of the study that had the women taking oral estrogen and a non-bioidentical progestin. Little note in that point. That's very important. So that arm of the study showed a trend. It did not reach statistical significance, but because it was a trend, they stopped that arm of the study. That was the beginning of the explosion of the fear of hormones. Okay. There was another arm of the study, though. These are women who'd had hysterectomies. And there's a prevailing understanding that a woman who's had a hysterectomy does not need progesterone. We can talk about that if we have time, because we've already said progesterone helps anxiety and sleep. Okay, so some women who've had hysterectomies, they will benefit from a little. But the going understanding for sure at that time was you don't require it because you don't have a uterus that you have to balance it at the level of the lining. So this is an arm of the study where women were either given an estrogen, not the right one, they were given an oral estrogen, but nonetheless given estrogen or placebo. The women on estrogen had a lower incidence of breast cancer. This data has come out almost 20 years ago, and nobody heard of it because the fear was it had already taken hold. Okay, so that was even with the wrong kinds of hormones, the wrong women being studied, because they were all 10, 15 years into menopause, so they weren't having symptoms, and the wrong route of administration of the hormones. So even with all those wrongs, it still found a lower incidence of breast cancer. So for a woman who is cleared by her doctors, I always want to collaborate with the whole team. All right. Does she have an oncologist? Who else is on her team? Where are they considering her treatment? The word cure doesn't get used a lot around cancer, but I'm hoping that going forward it will be used more in the future because my mom's a perfect example. She really was a cure. So in any case, we'll have that information eventually as we get more genomics and other types of testing and markers in the blood for cells of cancer before anything's detectable. So I think that'll come eventually. So for a woman who's got that in her personal history, it really depends on what's happening with her. Let's say she's having vaginal dryness and pain with sex. It is pretty accepted, even among oncologists, that it is okay for her to use a little tiny dose of vaginal estrogen in order to regain her quality of life. So there's that. If she's having hot flashes, other types of systemic symptoms, maybe she'll need to use some other methods. It really depends on everyone's comfort level. Another option is, to our discussion, is testosterone. Testosterone can help a lot with a lot of symptoms, the brain sharpness, even sleep, as well as muscle and metabolism. So testosterone is also pretty well accepted out there as something that is going to be okay to use after breast cancer.
So let's say somebody is 60, they opted not to have the hormone replacement therapy. They've, they've been in menopause, let's say 10 years, 8 years. Is it too late for them?
I love this question. The answer is no, it's not too late. It's not too late. What's really fantastic is that the Menopause Society, which formerly was the North American Menopause Society, they do a detailed review of the medical literature about every 5 years. And in their most recent one from 2022, they actually said that the data supports that there isn't an actual time where it's too late. The idea came, again, sadly, from the WHI, that there's a window of opportunity that's about 5 years, and once you're more than 5 years, you're out of luck. That came from that study, and it particularly came from using the wrong women and the wrong hormones. So these women were 10, 15 or more years into menopause. They didn't have any more symptoms. And what we assume is that they had other issues settle in by that time, other illnesses, loss of bone. Actually, the WHI showed that hormones help bone density, even if you start it later. So that was ironic. So the wrong women, and then also the wrong hormones. So the oral estrogen, as we mentioned, increased the risk of cardiovascular adverse events like stroke or heart attack or that blood clots, that type of thing. So it's really never too late. I would say, I take care of women of all ages because I'm seeing hormonal issues in younger and younger women, but really mostly women in their 40s and 50s. But I've had women, they come in. I had one woman, she was 60 and she did absolutely fine. She felt great, went into menopause, really didn't have any problems. And then she turned 60 and just everything just went downhill fast. And her biggest number one issue that we fixed really quickly was that she just couldn't sleep. So she'd been fine for years and years and then started having all of the problems.
Oh,
So
wow.
luckily, we were able to really, really get her feeling better, get everything working again, get the metabolism working again, all of those important factors. So really, in my view, it is, barring other contraindications, which are very rare, it's most pretty much never too late.